Mental illnesses have been on this earth since the emergence of mankind. Throughout history, some of the most controversial diseases to treat have been mental disorders. There have been attempted treatments for these diseases dating all the way back to 5000 BC. The earliest of these treatments included people sharpening stones and drilling holes into people's skulls to, quote, release the demons, unquote. Other treatments included exorcism, prayer, and other mystical rituals. These treatments dominated until 1406, when the first mental institution opened in Valencia, Spain. Ever since this first institution opened, there have been a lot of problems with mental institutions and controversies regarding them. Some of these controversies include unfair and unjust treatment of the patients. Some of the most common of these unjust treatments are restraints, seclusion, and not sufficient nutrients and water. Even today, there are 150 deaths per year due to restraints in the United States. This has led to the question of whether or not we should be institutionalizing these mentally ill people, if this is the best treatment that we can do for them, or if we should release them from the hospital, the instant asylum, and send them on their way. But before we dive into this debate over institutionalization and deinstitutionalization, I'll first take a look at the interest groups. There are 4 interest groups that I came up with. The first one being the mentally ill patients who would want the best care provided for them with the least amount of physical abuse and restraint possible. The second interest group being the families who would obviously want just their loved ones to be as happy as possible and not be having to go through pain and seclusion and maybe even one day treating the disease, which is what my third interest group would be doing. The doctors who obviously want to find new ways and create new medicines to actually not just help these mentally ill patients, but one day cure the disease. And the fourth group would be the people who just feel threatened by the mentally ill and who just don't want anything to do with them because they feel like at any moment they could snap and hurt them. So why do we care if the mentally ill are institutionalized or deinstitutionalized? Well, there are over 200 types of mental illnesses today, including schizophrenia, bipolar disorder, dementia, and depression. And according to the Schizophrenia-Related Disorders Alliance of America, 3.5 million cases of schizophrenia happen in the U.S. per year, 5.7 million cases of bipolar disorder happen per year, and 7.7 million cases of dementia happen per year in the United States. Another main point to make here is that 40,000 mentally ill, mentally handicapped people are living in institutions in the United States today, which is a great number of people, but it's not nearly as much as it was, say, 50 years ago, but I'll get into that later. Lastly, it deals with how people like you and me are going to spend the remainder of their life. Whether you're mentally handicapped or not, you really do want the best possible life that you can live out, whether you can think straight or not. Obviously, if you're mentally ill, you want the best treatment possible. So that comes to the question back to, should we institutionalize these mentally handicapped people, or should we release them from the asylums, mental institutions, and send them on their way? So institutionalization, the interest group that would want institutionalization would be the people who feel threatened by them because they feel like they should belong in there and should be admitted into asylums because that is the best way to keep the public safe, and also the people who think we don't have enough money or time to spend on thinking of ways to cure every mentally ill person, so we should just throw them and lock them away. The deinstitutionalized side of this goes with, if we institutionalize them, that is disrespecting their human dignity. And even the mentally ill have rights to be treated not like animals. And we also need to find better treatments. And the three interest groups who would want to deinstitutionalize mainly would be most of the patients, most of the families, and most of the doctors. Obviously, there are some exceptions, but generally saying that those are the three interest groups that would want the mentally ill to be released. So in the 1950s, there was a massive deinstitutionalization, from 500,000 people down to about 70,000 people, according to PBS.org. And this decrease in institutionalization was mainly due to the first antipsychotic drug, which is Thorazine. It came out and sparked this movement. And then, along with that, Medicare and Medicaid came into play, which helped them get treatment even if they didn't have a sufficient amount of money. And the implications of this movement were actually not what was intended, because so many people moving out of these institutions had nowhere to go. So where did they go? Many were forced to work in turkey factories for less than $100 an hour, and that was even up to as recent as 2009. This was happening. Actually, 29% of the homeless population was mentally ill in 1988, according to Paul Kugel. And according to PBS.org, 16% of prisoners today are mentally handicapped. So this is a very bad problem that we have in today's society. And Dr. Gary Bevan, the regional director of the Ohio State Prison, said, quote, "Providing effective psychiatric care in a maximum security prison is extraordinarily difficult. Many patients decompensate and become extremely depressed, hopeless, and even suicidal." So people notice this problem and are actively seeking to find a way to fix it. In today's society, we have Social Security, which it assists low-income individuals who are mentally handicapped by giving them money and providing them with some medicine even. There's also an increase in full-time mental health care social workers, and what they do is they provide their clients, the mentally ill clients, with referrals, counseling, and they work very closely with individuals and families. So, as we can see, the debate between institutionalization and deinstitutionalization, by the 1950s, a massive amount of prisoners were mentally ill, were deinstitutionalized, and we are trying to cope to fix that problem today.